60% of the nation's dengue patients are reported from the western province. Health officials have identified that the dengue disease is spreading rapidly in the Dehiwala, Watmalana, Kolonnawa, Buralaskamoa, Moratuwa and Burale areas of the Colombo district. Director of the Epidemiology Unit, Dr. Papa Palyawarana noted that dengue is also spreading rapidly in the Mahara, Kalaniya, Jawala and Watale areas of the Gampaha district as well as in the Horana and Pandra medical division in the Kalutara district. 6,466 dengue patients have been reported in the western province so far this year. 3,985 patients were reported from the Colombo district. 1,113 patients were reported within the Colombo municipality so far this year. A number of hospitals are overflowing with dengue patients. These are visuals captured from the National Hospital in Colombo. The situation is the same at the Kalubolvila Teaching Hospital.
Special in this year is the increase in this year during these months is higher than that of the last year. Now during this month there has been over 450 dengue suspected patients admitted to this hospital, and also there had been 5 deaths reported since January this year, and majority of them have been transferred from various institutions.
විශාල වශයෙන් ප්‍රතිකාර සඳහා පුනරෝගීන් වාර්තා වෙනවා. මෙම රෝගීන්ගෙන් මේ දිනවල වාට්ටු
We are seeing a large influx of patients. Our medical wards and children's wards are overflowing. We believe that they are dengue patients and we are treating them. Around 1,647 patients are currently receiving in-house treatment. 647 new patients came in during the month of May. So far this year, 10 patients have died. 6 individuals died this month alone.
This year we have had 104 dengue patients. We have also issued constant messages in order to keep the patients aware of the spread of dengue.
We have been experiencing congestion in our wards. However, we continue to provide medication without hassle.
Several years ago, the Minister of Health notes that the BTI bacteria would be used to combat dengue. Several tests were also carried out in this regard. However, these are the views expressed by the Western Province Health Director on the subject.
There are various views being expressed by specialists, so there is some friction. If we use BTI bacteria, mosquito larvae will definitely be killed. However, in order to reap tangible results, this should be used in the entire country. Our doctors have not been able to reach a consensus. If we can reach a consensus and use a solution such as BTI, then we will be doing a service to the society.
Meanwhile, the GMOA charges that the Western Province Health Director holding a position as an additional secretary in the Ministry of Health has thrown the administration system into a disarray. The GMOA stresses that this is hampering dengue eradication activities in the Western Province.
There is wrong being committed from the highest position to the lowest position in the Western Province. The Western Province Health Director is holding a position as an additional secretary. Illegally, there are 34 corruption charges against this individual. When he is charged with corruption, then how can he take steps to cure our children? How can he advise people to work well? We call on this individual to be removed from this position. At a time when the number of dengue patients are on the rise, the director in charge of Western Province Summary Health Services needs to take over as the Western Province Health Director. She is a very talented individual. Then he will block everything and will not allow her to work. We engaged in cordial discussions with the GMOA and resolved this matter.
Meanwhile, the Minister of Health recently expressed these views on the eradication of dengue.
මැලේරියාවට අවුරුදු 80ක් ගියා කියලා ඩෙන්ගු වලට අවුරුදු 80ක් යන්න ඉඩ දෙන්න පුළුවන් කමක් නැහැ. ප්‍රධානම ප්‍රශ්නය
It took 80 years to eradicate malaria. We cannot let dengue eradication take 80 years. The main issue is that certain divisions are not fulfilling their duties. If there is a problem in fulfilling these responsibilities in some areas, then inform us about it. You can berate me. I don't mind being berated by the whole country. We should clean up schools even if we have to resort to closing them down. All divisional heads need to fulfill their responsibilities.
මේ පිරිසිදු කිරීම කරන්න. මේ සියලු ආයතන ප්‍රධානී මේ පිළිබඳව තමන්ගේ වගකීම ඉෂ්ට කරන්න.
Who is responsible for the failure to eradicate dengue? This was the question we posed to our viewers on our website www.newsfirst.lk. Here's few of the responses.